Hi, everyone. Welcome back. We are discussing boundaries today. This is the Behavioral Health Certificate Program, and we are in Module 4, which of course is Professional Communications and Behaviors module. When we think about boundaries, much like this picture depicts, we're staying within certain lines and trying hard not to cross those lines. And our little trust buddies on the bottom left remind us that by keeping good boundaries, we're building trust with our patients and clients. Now, boundary crossings are brief excursions across professional lines of behavior that may be inadvertent, thoughtless, or sometimes even purposeful. We think we're being helpful while attempting to meet a special therapeutic need of a patient. Boundary crossings can result in a return to established boundaries, but should always be evaluated by the medical professional for potential adverse patient consequences and implications. Repeated crossings should be avoided. It's something that you want to be mindful of and that you want to examine yourself as a professional if it does happen, just to be sure that you understand, was this a therapeutic crossing and one in which I was able to return easily, or is this problematic and it's happening often? These are really two very different ways of looking at it. And just remember that boundary crossings sometimes are very close to violations, and you want to be careful because it can become a violation. Violations can result when there's confusion between the needs of the medical professional and those of the patient. These violations are characterized by things such as excessive personal disclosure by the professional, secrecy, or even a reversal of roles where our patients become the therapist or our patients become the caregiver and we're telling our patient our problems. That is a violation. And it can cause distress for the patient, which may not be recognized or felt by the patient until harmful consequences occur. And medical professionals' use of social media is another way that we can unintentionally blur the lines between our professional and personal lives. It's never okay to be posting information about a patient, for instance, on your Facebook page. Making a comment via social media, even if done on a medical professional's own time and in their own home, regarding an incident or person in the scope of their employment, is or can be a breach of patient confidentiality. I would go out on a limb and say it is. You should not be talking about your patients on Facebook. On the other hand, if you want to post that you just ran a 5K for diabetes that was sponsored by your agency, that's a different thing. That's not a boundary crossing. Here's a nice picture. To the naked eye, anybody walking by, that looks like a boundary crossing. There could be things that we don't know. Maybe they're brothers, but we have to be careful of perception. That's the point of putting this slide in here, is other people don't know. So, you know, you always want to be mindful that others are watching, and even though it may not be really a boundary crossing, to others it may be perceived to be, and so therefore it is. You want to be careful. Boundaries in medicine. It's very connected, boundaries, to the continuum of professional behavior. The more professional a person tends to be, the better their boundaries tend to be. If our boundaries are very poor, we're going to be thought of as not a very professional person. It's our responsibility as the medical professional to maintain and delineate what those boundaries are, especially if we have patients who are confused about that, or perhaps it's a concept that they've never been introduced to, and we might be the first one talking to them about such things. We should work within the therapeutic relationship And we should examine any boundary crossing, be aware of their potential implications, and avoid repeat crossings. That's our responsibility. There is a website listed on the bottom here. It's also on the next slide, giving you a hint in case you want to take a snapshot of it and not have to re-watch this to get the website. But it is a good resource for discussing boundaries. And it gives you like an actual PDF that you can pull from. And there it is again on the bottom. You can take a snapshot here if you'd like. Variables such as care setting, community influences, patient needs, and the nature of treatment affect the delineation of boundaries. So there might be a community setting, a family medicine type of setting where the doctor has been the family doctor for 25 years and have had all the children and the grandchildren and the parents. The boundaries might look a little different in that setting as compared to, say, an urgent care where you're walking in off the street and you don't know anybody there, or a mental health setting where it's really especially important to keep boundaries. And I'm not saying that it's okay if you're in family practice to break all these boundaries. I'm just saying it might appear a little more relaxed in that setting as compared to some of the others, like an emergency room. Actions that overstep boundaries to meet the needs of the medical professional are violations. And the medical professional should avoid situations where they have a personal, professional, or business relationship with the patient. Those are all violations. I can't go into business with one of my clients, and I can't date my clients, that kind of thing. Post-termination relationships can be complex because a patient may need additional services. They may have a rebound in symptoms and have to come back. They mention oncology patients here or mental health patients. When you're terminating with a client, it's very important to be clear around what the expectations are as far as when might you come back, what would the circumstances be, and would I be your provider? Maybe it would be someone else, that kind of thing. Do you want there to be no misunderstandings about what termination means? And it doesn't mean that we can now be friends and have lunch, kind of thing, which we'll talk about on the next page. Red flag behaviors. There are some behaviors that can indicate a potential boundary issue. And these, when you read them, you'll be like, oh, I'm not confused about that. That's definitely a boundary crossing. But I'm going to make this slide larger so we can read these. And then I'll have to make it smaller to go on to the next slide. But here are some behaviors that would be considered inappropriate and might be subtle at first, but are early warning signs. And we want to really be careful and react to this right away if these things are occurring. Discussing intimate or personal issues with a patient is a problem. Engaging in behaviors that could reasonably be interpreted as flirting. Keeping secrets with a patient or for a patient. Believing that you are the only one who truly understands or can help the patient. I place that one especially in red and just table that. No doubt this will be one we'll talk more about when we come together as a group. No one is indispensable, and we don't want to set people up so that they're relying on a professional to meet their needs and not use their natural supports and or their own life, whatever's available to them in their day-to-day living. That would be problematic. Spending more time than is necessary with a particular patient is a warning sign. Speaking poorly about colleagues or your employment setting rather with the patient and or family, showing favoritism, getting people ahead of the waiting line, that kind of thing. Meeting a patient in settings besides those used to provide direct patient care or when you are not at work. Meeting for lunch, that kind of thing is not okay. What if you're all gonna run in the 5K together? Then maybe it would be a different thing where the community is signing up and you're signing up as a professional and it's something that you're doing as a group would be a different story. We'll get to talk about all of these things. I will say that if any of these red flag behaviors are noticed in either yourself, your patients, or others, you want to bring that to the attention of one of your supervisors or someone in your chain of command so that you can avoid harm to the patient. And I think, yeah, that's it. That's all we got for boundaries. Special thanks to Professor Beth Lewis, who developed this particular module. And please remember to complete your quiz. Thank you for all the hard work you're doing. I realize that many of you are working while you're also in school and taking the time now to watch webinar and figure out Zoom and all of the other expectations that are piled on because of the certain circumstances that we're all living under right now. So appreciating you and see you soon. Thank you.